Have your eyes ever become so itchy that you feel like you could rub them for hours? Maybe they are watering constantly. Maybe they are red, irritated, sensitive to light, or accompanied by a headache. And perhaps the most frustrating part is that every time you think you've found some relief, the symptoms seem to come back again. If that sounds familiar, stay with me because today we're going to walk through some of the most common symptoms associated with eye allergies, practical steps discussed in the source material for managing them, and 4 common mistakes that could be making the situation more difficult. And I especially want you to stay until the end because one of those mistakes is confusing allergies with another eye condition that can look surprisingly similar. That distinction matters. Let's start with what is often the most frustrating symptom of all: the intense itch. Not just a little irritation, I'm talking about that overwhelming urge to press on your eyes, rub them hard, and try to make the sensation stop immediately. But here's the first important thing to remember: intense rubbing is exactly what you want to avoid. When your eyes are itching badly, rubbing may feel like the fastest possible solution, but putting repeated pressure on the front of the eye can be harmful over time. And if your hands are not perfectly clean, you can also transfer debris to the eyes and eyelashes, potentially making the irritation worse. So, what can you do instead? The first step is surprisingly simple. Wash your face, and if possible, take a shower and change your clothes. Think about what may have happened throughout your day. You may have spent time outside, and allergens may have settled on your skin, around your eyes, and on your clothing. Washing your face and showering can help remove allergens from those areas rather than allowing them to remain in contact with you. Now, the source material also discusses oral antihistamines that are commonly available over the counter, such as loratadine or cetirizine. However, before starting any medication, even one available without a prescription, it is important to check with a doctor or pharmacist about whether it is appropriate for you and whether it could interact with your current medications. The source also advises against simply changing or combining medications on your own and recommends discussing persistent symptoms with your doctor. If you've already taken an allergy medication and you're still miserable, don't assume that more medication is automatically the answer. Persistent symptoms are a reason to speak with a healthcare professional about the safest next step. Another option discussed in the source is using an over-the-counter eye drop specifically intended for itch relief. If you choose an eye drop, read the label carefully and use it according to its instructions. And if you wear contact lenses, remember that the source specifically advises removing your contact lenses before putting eye drops into your eyes. Now, let's go back to that unbearable urge to rub. What if you feel like you absolutely cannot stop yourself? The source suggests avoiding rubbing directly on the eyeball. The key idea is to avoid putting pressure on the eye itself. And that brings us to symptom number 2, watery eyes. This one can be confusing. Your eyes are already producing tears, so why would you need artificial tears? It seems completely backward, doesn't it? Your eyes are watering, and someone tells you to use eye drops called artificial tears. But according to the source material, watery eyes can occur with allergies, and dry eye can also exist at the same time. The source explains that when the eye is dry, it can signal the brain, which then signals the tear-producing glands to make more tears. But those tears may not provide the quality of hydration the eye needs. In other words, an eye can look watery while still experiencing dryness. This is why the source discusses artificial tears, ideally preservative-free, as something that may help when watery eyes are part of the problem. But don't assume every watery eye has the same cause. Watery eyes can happen for different reasons, and if your symptoms are persistent, severe, or unusual for you, it's worth getting professional advice rather than trying to diagnose the cause based on one symptom alone. Now let's move on to two symptoms that can sometimes appear together: headaches and light sensitivity. Imagine this. Your eyes are itchy. They are watering. They're irritated. You find yourself squinting more than usual. Maybe bright sunlight suddenly feels more uncomfortable. Maybe you have been trying to focus despite the irritation, and now you also have a headache. The source explains that eye allergies can sometimes be associated with headaches and light sensitivity, although this does not happen to everyone. Visual strain, dry eye, watery eyes, and itching may all contribute to an uncomfortable combination of symptoms. So what can you do? The practical approach described in the source is to reduce your exposure to possible outdoor allergens, take a shower, stay indoors when appropriate, and give your eyes a break from bright light. That could mean sitting in a room without harsh lighting and taking some time away from bright sunlight. Think of it as reducing the number of things irritating your system at the same time. If the outdoors are exposing you to allergens and bright light is aggravating your discomfort, stepping into a calmer indoor environment may provide a break from both. Artificial tears are also discussed in the source as something that may help with light sensitivity when it is associated with eye allergies. But there is an important warning here. A severe headache is not something to casually dismiss as just allergies. The source specifically advises checking with a doctor if a headache does not go away with normal over-the-counter pain medication, or if it is incredibly severe, to make sure something more serious is not going on. And that brings us to the next part, because sometimes managing symptoms isn't only about what you should do. It's also about recognizing what you may be doing wrong. Here are 4 common mistakes discussed in the source. The first is not knowing what you're allergic to. This is a big one. You can't effectively avoid something if you have no idea what you're trying to avoid. Different people may react to different allergens. One person may be more affected by tree pollen. Someone else may be affected by ragweed. Other people may have completely different triggers. The source suggests allergy testing for people whose allergies are making them miserable, because identifying the trigger can help you understand what to avoid. Once you know what you react to, you can also pay attention to when that allergen is more prevalent in your environment and make more informed decisions about your exposure. This can change the way you think about allergy management. Instead of waiting until your eyes are already intensely itchy, you begin asking a different question. What is triggering this in the first place? Because sometimes the most useful strategy is not simply reacting to symptoms after they become unbearable. It's understanding your triggers and discussing a prevention strategy with a qualified healthcare professional. The second common mistake is not using medication consistently when it has been recommended for regular use. The source points out that consistency can be difficult, especially when you aren't experiencing symptoms at a particular moment. But during allergy season, consistent use of a medication regimen, prescribed or recommended for you, may help keep symptoms under better control. Of course, follow the directions provided by your healthcare professional and the medication label. Don't change the dose or frequency simply because symptoms suddenly feel worse or better. The third mistake is not considering more advanced solutions when basic approaches aren't enough. Sometimes people tolerate miserable symptoms for far too long. Maybe you tell yourself it's only seasonal. Maybe you think, I'll just get through it. Maybe every year is a little worse, but you keep repeating the same routine. The source discusses seeing an allergist and asking about more advanced options, including allergy shots, also known as immunotherapy, and certain sublingual or under-the-tongue treatments for particular allergens. These options are not necessarily appropriate for every person or every allergen, and the source emphasizes that allergy shots do not work immediately and require consistency. That is exactly why this is a conversation to have with an allergist or other qualified healthcare professional if your allergies are seriously affecting your quality of life. And now we come to mistake number 4. Assuming that allergies and pink eye are the same thing. This is where people can get into trouble because symptoms can overlap. The source notes that allergies can resemble pink eye because both can involve itchy red eyes. But similar-looking symptoms do not automatically mean the same underlying cause. So if you are dealing with red, irritated eyes, don't automatically decide that it must be allergies just because you've had allergies before. And don't automatically decide that every red eye is pink eye either. If you're unsure what you're dealing with, getting appropriate medical advice can help you avoid treating the wrong problem. Now let's bring everything together. If itchy eyes are driving you crazy, start with the basics discussed today. Don't aggressively rub your eyeballs. Wash your face. Consider showering and changing clothes after exposure to potential allergens. If medication or eye drops are part of your treatment plan, use them safely and according to professional advice and label instructions. If you wear contact lenses, pay close attention to the instructions for any eye drops you use. If your eyes are watery, remember that watering does not necessarily mean the eyes are adequately hydrated. The source discusses preservative-free artificial tears as an option to consider for symptoms associated with allergies and dryness. If headaches and light sensitivity appear, give yourself a break from bright light and potential outdoor allergen exposure. And if symptoms become severe, unusual, or don't respond as expected, don't just keep guessing. Talk to a healthcare professional. Most importantly, try to identify your triggers. Because knowing what sets off your symptoms can help you make better decisions about what to avoid and what questions to ask your doctor or allergist. And before you leave, I want you to think about this. What is the one symptom that bothers you the most? Is it the itching? The constant watering? The redness? The headaches? Or that uncomfortable sensitivity to light? Let us know in the comments, and if you found this video helpful, subscribe to Auralith Wellness for more practical wellness content designed to help you better understand the signals your body may be giving you. And remember, your eyes are not something to take for granted. Don't ignore persistent symptoms. Don't aggressively rub your eyes for temporary relief. Don't assume that every red or itchy eye has the same cause. Fais attention. Learn your triggers. Use treatments safely. And when something doesn't seem right, get professional medical advice. Thank you for watching, and we'll see you in the next video.